So next, I'd like to run through a few of the premier or most important supplements that are used in conjunction with the IV NAD. And these are in part also some supplements that are used for the purification part of the entire program. So let's get started. So let's talk about how to support the NAD IV therapy with various supplements. And we use a lot of, not a lot, but we use a number of supplements for people, but I'm going to just cover some of the highlights of the most important ones. So again, we have the Krebs cycle happening inside the mitochondria. And here is another way of illustrating this cycle, and I'm going to point out a few things regarding cofactors, coenzymes that are dependent upon different vitamins and nutrients. So here are all the Bs, and starting from the 12 o'clock, the top, B5 pantothenic acid, come around to next one, niacin, then we have B1, 2, 3, and 6, pyridoxine. Preferably a mix of regular pyridoxine, B6, and also what's called P5P, or pyridoxal 5-phosphate, which is the pyridoxine has to be sort of transformed into the P5P form to get into the mitochondria. So we use both forms. Then again, B2, B3 again, and before the Krebs cycle, we have a few upper left, others that are involved with the preparation, and NAD is involved with that as well, to get into the first doorway, acetyl-CoA, into the Krebs cycle. And then we have some different antioxidants, lipoic acid, coenzyme Q10, that are also really important. Notice the lower left, there's other nutrients that are also needed throughout the cycle. Probably just too difficult for them to put those into the cycle without it being too jammed. So this is one product we use which we found really important. There used to be others, but for some reason this is the only one that's kind of left to be available. And you'll notice here, those are all the nutrients needed. And then on the right side, you see at the top, N-acetylcysteine. The mitochondria are pretty incredible because they produce their own antioxidants, glutathione, etc. But usually when there is mitochondrial dysfunction, the level of these reactive oxygen species, which I mentioned before, play an important function inside the cell. But when there's dysfunction, these ROS, reactive oxygen species, start to increase more than they should, and the production of the antioxidants by the mitochondria start to decline. And that's why these nutrients are so important to, in some ways, neutralize the overproduction of these free radicals. So let's talk about what happens to the both outer membrane of a cell, and also the outer and inner membrane of the mitochondria, is that there is kind of a breakdown or degeneration of these membranes, and it's really important to provide the nutrients, primarily what are called phospholipids. And those are the three. Ethanolamine is really important. I mean, they're all really, really important phospholipids. Normally, this part here, the endoplasmic reticulum, another organelle inside the cell, is what is helping to manufacture the lipids required for these membranes, for the inner membrane of the mitochondria. So there might be others on the market, but I think these are the highest quality coming from Body Bio, Drs. Kane. I think they probably did a lot of research about this. I think a lot of the research came out of Europe. So those are the same product, just one is in liquid form. It's much more, it's an inexpensive product, but for the price and what you get. The liquid is much higher concentration and less expensive for the amount, and then there's a capsule form as well. And then to help the liver, support the liver, we use this hepatogest powder. It's herbal based, and this just simply supports the liver, because during the purification the liver is under a great deal of strain, and most people's liver is not working all that well. We use also IVs and alpha-lipoic acid, etc., to improve liver function, and then you can also take it in tablet form. People are taking this during the whole program to support purification. Gut is really important. Most people don't have enough good bacteria in the gut. Most people have taken a lot of antibiotics, and the first sort of category of good bacteria that's reduced by antibiotics is the category of the soil bacteria. So we found precipitous cysts is one of our major things that people come back for over and over again, because it just really helps with their gastrointestinal symptoms. And if you can improve their symptoms in the intestinal tract, many other issues, systemic issues, start to decline. Pectosol we use primarily to help absorb, like a sponge, toxins and residues in the intestinal tract, so they're not reabsorbed back into the body again. And NAT CLR clear is also something we use if people are having problems with constipation, just getting the bowels to move when they're here, so they don't get feeling sicker and sicker. And we combine these with also our colon hydrotherapy. Kidneys, you in general usually aren't too much of an issue for as far as their function is concerned, unless the person has had exposure to a lot of heavy metals and dental amalgams, etc., eating a lot of sushi and things like that. But if there's some blood tests we do, urine tests. Asparagus is really a good sort of natural way of opening up the filtration rate, the glomerular apparatus, to help drainage through the kidneys. And then, of course, our saunas, back again, supportive supplements. Niacin again is part of the NAD, so it's a good nutrient to take anyway, but niacin is a great way to help the body to increase its circulation to the skin, and therefore helping to be more effective with the removal of toxins and residues from that subdermal fat layer out through the skin. So there are many other supplements, but I think those are the ones that cover the most important. Thank you.